Okay, I am going to get started. This is Greg Babinski from the King County GIS Center in Seattle, Washington. Welcome everybody to the April 1st King County GIS user group session. Many of you may not be aware, but our bi-monthly user group is always open to the public. Usually it's held in our offices in Seattle, but this is all 100% via Skype today. Thinking about April 1st, actually 1 month ago today, March 1st, I was on an Alaska airline flight from Detroit coming back to Seattle. And earlier the previous week, before I left for Detroit from Seattle, I called up Alaska Airlines and asked them what special precautions that they were taking related to COVID-19 in sanitizing planes or, protecting passengers or crew and things like that. And the answer was nothing special. So what a difference a month makes. We're in a whole new world within the last month, and I think the world is truly evolving, and GIS is obviously a big part of effective response to COVID-19. And so that's why we've organized this session today. For those of you who can see my screen, basically our agenda is I'm going to do some introductions for about 5 minutes. We have 9 scheduled speakers. One of them is not available, and they'll each speak from 3 to 5 minutes, maybe a total of 45 minutes maximum. A few of them will be just speaking. Some have material to share, and I'll either be showing that material for the speakers or sharing the screen with them. And then we'll go into a roundtable between the speakers, giving them an opportunity to ask each other questions. And then we're going to have an open forum, so questions will be open to any of the people who are participating in this call. It will be a challenge with so many people to get my attention. So I'm going to ask you, if possible, if you have a question that you want to ask a specific speaker or all the speakers in general, that you type that in the conversation section of the Skype application, if you have that. And then I'm going to ask my colleagues, Mary Ulrich and Patrick Jankanish from the King County GIS Center, to sort of monitor those questions, and then I will ask them to ask questions that you've entered into the conversation chat area of the application. And we'll try to do that for about 20 minutes, and then we should adjourn about 12:30 p.m. Pacific time, about an hour and a half from now. I'm certainly going to stick around for a while, if there are any lingering questions or networking that is valuable, but that's the plan for today. So
demos to people who were involved at the EOC, and Esri was super generous with their time hooking us up with people who knew that area. But once we got people's attention at our Emergency Operations Center and in the departments and at the mayor's office, they were all interested in data. It was data, 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 data all the time. I think the first thing that we were asked for was the fire chief, Chief Scroggins, wanted us to map all the senior care facilities and which of them had COVID, so that in their first response, they could prepare themselves before they entered. At that point, I think there were like 11 senior care facilities with COVID on premises, and now I think it's up to something like 30, and that may be the whole county, but anyway, it's really grown. The next thing that really came up, they wanted us to map daycares, and then I don't think they did anything with them, and then they quickly switched to they wanted hygiene stations and comfort stations and open bathrooms and so forth, so that became a big emphasis. That one was really difficult. My colleague Brian Rossetti, we call it herding cats, has been trying to collect that information. I think the City of Seattle has something like 120 different locations that were identified, but the numbers kept swinging from 133 to 100 and back to 110, and just getting a data set like that together is rather difficult. And I have to say that the hardest thing about response to this sort of thing is never the technology, or sometimes it's the technology, but usually it's the data. It's wrangling this data, figure out who's going to edit it, who can enter it, what's the source of truth. Actually, someone is not muted, and I'm hearing a lot of shuffling and doors opening and closing. Let's see. So actually, what became all-consuming to me, at one point we were talking to the mayor's office about possibly using the Esri Hub, and then we realized that they had put up a pretty awesome website with resources for the community, and a lot of the FAQ type information that we thought we would put on the hub was already there. But they told us what we really need, what we really want to do is set up a website for restaurants that show who's open for takeout or delivery. So we switched over to that, and we created a nice application using Web App Builder and some ArcGIS Online resources, Survey 123 and so forth, and developed pretty much 3 websites, one for the public, one for business owners to log into to enter their data, and then a back-end editing tool for City of Seattle kind of administrators to keep track of things. And that was released on Monday and got a lot of attention, and we promptly got, I think, 300 emails the first day, another 300 the second day. So there are something like 600 restaurant owners wanting us to help them get them on the map, and they've all been sent the link to the business owner's site. So, but we still need to shuffle through that. So we've been adding staff to that effort. I've never used a shared email address before, so that's been a learning process. So I think those are the main things I wanted to talk about. Those are the things that have come across my desk. One thing I wanted to mention was there was a concept early on of collaborating across King County on a site that we could all contribute data to, and but it seemed that all the cities were pretty internally focused on their own operations. So I think now that maybe people are coming out a little bit, their heads aren't in the sand anymore, we can start talking about that again. I hope we can revive that idea, because I think a county-wide restaurant map wouldn't be the worst idea, to tell you the truth.
That'd be a great conversation later with George, Stephen. So our next speaker is Katie Miga. She's from Fairfax County, Virginia. She told me just yesterday. I had her listed as GIS analyst originally. Now she's GIS project manager. Katie, are you on the call?
Yeah, I'm on the phone, and it keeps muting me, so hopefully it won't mute me while I'm speaking. But yeah, so I wanted to go over a couple things. We're obviously in Fairfax County, we're a little bit behind since COVID didn't really affect us until probably 2 weeks ago or so. So I put together a quick story map to just show what we've done so far. So we've really had 3 big initiatives. We put together, the GIS division put together a hub page using the Esri template that they put together. The health department has done some really cool dashboards for their epidemiology group. And my main work has been using GIS for equity purposes in the county. And then I just want to go over a couple of the things we have planned, and then talk about some of the challenges that we've had so far. So our hub site it's using that Esri template. I'm sure most of you have seen it already. So some of the requests for what's up there has come from the emergency operations centers. So the main one we have up there is the food resources. So because the schools, once they closed, any of the kids that had the free and reduced price lunch obviously could no longer get that. if they weren't going to school. So that was one of the big pushes from the school system, was to make sure that we mapped that. So we created the layers for that, and where the school locations were that that people could get the food resources. We also mapped pharmacy resources, hospitals and urgent care locations. I also ran through Business Analyst online. They created Esri created a couple different infographics. So I made one of those infographics that really highlights some of those vulnerable populations. So that's also part of the hub page. And it also pulls in the various feeds that Esri provides. So the next thing we did is the health department dashboard. And this shows there's two different tabs that use the dashboard app through AGO. So the first, and this is internal only, so this is not something that is being shared with the public. This is for the epidemiologist in the health department to use. So they can see, you can see on the map there that there's actually 8 emergency departments in the county. So they're tracking how many people are going to those emergency departments. So you can see which emergency departments are getting more visits with people with coronavirus-like illnesses, because of course before they test them they can't say that they have it, but they have those symptoms. But it's also showing what zip codes those people are coming from, so that the epidemiologist would be able to track if there's any hot spots of, you know, this certain zip code has way more emergency department visits than others. And then the next dashboard shows it in a regional view. So obviously Fairfax County, we're not an island. We have a lot of surrounding jurisdictions, very populated surrounding jurisdictions. So this shows that same data, so where, what zip codes those people that are visiting the emergency departments, where they're coming from. And this can be viewed daily, so you can see every day where those visits are coming from, or also if you wanted to see weekly or 2 weeks at a time, which is really all we've been dealing with it so far. So that's for the health department, is using those dashboards, and they've been using that operationally. And then the final topic of what we've been doing is using this for equity. So I created, probably about 6 months ago, I created a vulnerability index for the county. And this is what's being showed now is by census tract. So I pulled together population of color, households without vehicles, population without health insurance, and median income and burden renter data to show where the highest vulnerable populations in the county are. So we were able to use that data since we already had it and overlaid some of the response data. So one of the first things I did, again, and this is internal for our planning purposes only, if you go to the next, scroll down to the next screenshot, is I took what the schools had done for their food service and overlaid it on top of the vulnerability index, so we could just look at that to make sure that those vulnerable populations are being served. And I'm doing that with other resources as well, just to ensure that if there's any sort of gaps in service, just to make sure that leadership is aware of that, so that they can respond appropriately, and if they needed another site for food resources, or anything like that. So that's pretty much what we've done so far. Some of the things that we're planning for next steps is the health department has actually offered to give us data based on who has been tested so far for COVID, address data that we could map to ensure that there is equitable distribution of testing, so that it's not, so that those vulnerable populations, that they have access to the test as well. We also want to keep track of requests for service. So there's one centralized location where service requests come in from residents, whether they're requesting food or clothing or housing, and to track that data to see is the locations of where those people are calling from different? Or is it the same locations but higher numbers? Or is it something that people are calling from all over the county from places that we normally don't get calls? And then the final thing that I'm working on is mapping the health department outreach locations just to verify that the vulnerable populations are being served. As far as challenges, I'm sure this is challenges that we've all been handling, is everyone's working remotely. So trying to coordinate between different groups of people, especially different groups that don't necessarily work together all the time. And some that don't typically use GIS, so they don't really know what you're asking them for, how it can be used, or how, you know, if we're given address data, that we're not just going to publish that to the public. So trying to work through some of that, and also trying to build new relationships for data sharing. Again, so I started this job on Monday, so I don't necessarily have all these relationships already, so it's kind of like starting to get contacts with people that we need for data to be able to put some of these applications together. That's pretty much all I had.
That's great, Katie. You've been doing a lot there, and I've certainly gotten some ideas from some of the things that you're doing that we should explore here. So next, our next speaker is, we had a city speaker, county speaker. Now we're gonna, a couple speakers from state coordination level. And the first speaker is Joanne Markert, Washington State GIS Coordinator. And Joanne, I think you were gonna take control of the screen, is that correct? Joanne, are you there? So I'm going to stop sharing, and then I think that will allow Joanne to take control of the screen. Joanne, are you there? Hello, Joanne. Oh, Joanne's on mute. Just a second.
Can you hear me now, Greg?
Yeah, I can. Great.
Okay. I'm not able to share my screen for some reason. It says it's disabled by policy. I can just kind of talk through it unless there's some way that you can grant me control.
Let's see if I can find you and grant you control.
Or make me a presenter, perhaps?
Yeah, so so I don't see you here.
I think I got it.
Okay.
Let me see. It says that I was switched to a presenter.
Okay.
All right. Let me make it smaller. Okay, can you guys see it? It looks like you guys should be able to.
Great.
Terrific. Well, thanks. Okay, a couple of things that I want to start off with. So I'm Joanne Markert. I am the State GIS Coordinator for Washington. And first of all, thanks a lot, Greg, for coordinating this. Obviously very topical and really important for us to try to stay on the same page as we work through this emergency. And also hats off to everybody who has been working in the State Emergency Operations Center. I've spent a couple of days what they call on the floor down there as well. And I know that they're all working very hard, and they are using a fair amount of GIS. And then I'm taking some shifts in that department at Camp Murray just to make sure that our GIS folks don't get too burnt out. Everybody's been doing a really terrific job. So just a big hats off to everybody working on this for Washington State. What I would like to do is just review a couple of the things that we have available in Washington for folks to use. So one thing, so we have a couple of dashboards that we've created. I just recently shared them up to the geo.wa.gov, and I'm going to show you a couple of different locations for some of the information that is public. We have a by county dashboard that is up here on geo.wa.gov. We have a dashboard with the facilities for essential workers. That's regarding specifically, in this case, mostly the schools, Boys and Girls Club and school districts, and who their contacts are. We also have the data. So I think some of you guys might be looking for rest services and stuff. So if you search for, I think it's county cases, it's not exactly the best name there, but if you go in and find this information, that's the data feed from Department of Health that's coming in as a rest service. Just be aware that there are unassigned cases. They have to do some research and other investigations before they can assign it to a county. So there are cases that aren't assigned specifically to a county. And so there's some numbers in that rest service that indicate that. So just be aware of. I just recently updated, if you go to the ocio.wa.gov, and you go to Program, Geospatial Program Office, I have a COVID map links, and it just goes out to a Word document, and it has any of the things that folks have sent me, anything that I've thought that is useful or potentially interesting for folks, and it includes actually some infographics that I've gotten from ESRI about each of the counties regarding how much insurance there are, some of the things that are derived from the business analyst. It has the link to the information from Department of Health. We have links to our state emergency operations and just other pieces of information that might be of interest. We also have the individual states when we found dashboards or other things that other states are doing. A lot of these have been shared at the national level. And thanks to Lorraine Fueler from Wahkiakum County for putting this nice little list together and the links. And so sharing it back out there so that we can all get ideas from what others have been doing. Then one other spot that we have that actually us as GIS folks may not always think about, but we do have this other site at the state called data.wa.gov, and that's for open data in general. And if you search for COVID, you'll find some of the data sources that we're trying to get out there on open data. The one that I thought was most interesting that I just learned about today was some of this distribution of funds. This is coming through OFM and updated. I don't know exactly how often it's updated, but it's updated out here to our open data site, and then unemployment insurance claims and benefits. And so we have other folks that are working on the open data side of things from our state libraries, trying to get information posted up here as we're able to find it and link into it. And then a lot of these things can be mapped. You know, we've been working on, as probably everybody has, just a lot of different information, whatever requests, pieces of information that the State Emergency Operations Center needs or our own agencies needs. For WATEC, where I work, we're interested in getting wireless service out to some of our rural communities, looking at how to place hotspots out there so that they'd be able to access it for both teleworking and then all of the students that are looking to do school from home as well. And so I think it's interesting to see how many different ways GIS can be used. And I really enjoyed watching Katie's presentation about the equity. I thought that was a really very interesting component of this as well. And this is going to continue to evolve for many weeks for us. And so I think that sometimes we will spin things up, and then we were taking care of like which schools were closed and showing those on a map, and then all the schools were closed. So that wasn't really something important to map anymore. So I think part of it is just trying to stay nimble and flexible as we move through some of these different scenarios. I did have one other thing I wanted to show you guys, and it's kind of interesting because it's something I have been interested in for a while, and now it kind of gives us an opportunity to think of when this could be applicable. So we have open data sharing, and that's the geo.wa.gov. We've been working on what I call GeoPortal Part 2, which is trying to get a state-to-state sharing of data even a little bit more solidified, and being able to share information through portal-to-portal collaborations. And then actually GeoPortal Part 3 would be state and regional and local partners, and I feel like this emergency scenario has really kind of given us the need for this type of data sharing. So I'm really interested in pushing this agenda. I will be asking the legislature for some additional funding to help support this, but I think for all of our emergency responses, this is going to be an important part of our future. Thank you.
Great, thanks, Joanne, appreciate it. I'm going to take control back now, if I can. And the next speaker, Daniel Stoelb, GIS Program Coordinator, Oregon Office of Emergency Management, was called away at the last moment, but he did give me the link to his main public website, which I am displaying now. Can everyone see this?
Can't see it yet.
Can't see it yet. Let me try again. How about now?
It says it's loading now, Greg.
Loading.
Okay.
It's there.
Okay. And, you know, so I can't do anything other than to just scroll through this, but you have the link there, Oregon-coronavirus-geo.hub, arcgis.com. So from the recording, if anybody wants to go back and explore this a little bit more to see what they're doing, you can see there's some, you know, they include the governor's daily briefing, and then their case map, which, you know, then of course is going to allow you to drill into county level data and then some other resources and trying to make contact with the state, exploring state of Oregon, COVID-19 related GIS data. So that's, I think I just wanted to show you that Daniel did provide this. Unfortunately, he can't be with us today. And so I'm going to go on to our next speaker, who is Joseph Elfelt from mappingsupport.com. And Joseph, are you there? Joseph, if you can unmute yourself. Try #6. Joseph, are you there? I presume you can see the screen that I'm displaying. Great. I'm going to give Joseph another minute or two, to maybe another minute. If he can connect with audio, that's great. If not, I'll go on to the next speakers, and then maybe Joseph can jump in at the end of the roundtable. So why don't I assume that Joseph will join us a little bit later, and our next speaker is Cheryl Wilder. She's a health GIS professional from Harris County, Texas. Cheryl, are you there?
Yes, I'm here.
Okay. What do you have to share with us?
Okay. Now, because I actually work every day in health GIS, and I got a buy-in from our team for me to participate, providing I wasn't sharing anything that could be considered, patient health information or anything that would be considered under HIPAA. So just a little bit about Harris County. I think we're the third largest county in the United States. And if you go to our Harris County Public Health website, you'll see a lovely dashboard that was put together by OEM, and you'll see the wonderful dashboard that was put together by Johns Hopkins. But that's not what I'm here to talk about. What I'm here to talk about is what can we do as GIS professionals to get prepared and to stay prepared, in the case of events like HIPAA, like COVID. I just wanted to make that little quick caveat. So my focus is what GIS professionals need to do to get prepared and stay prepared to be of service during COVID. There's a wonderful presentation by, and I'm going to click on it here, and we can add it to the notes after this seminar. But if anybody wants to go to it while I'm talking briefly, it's called Navigating HIPAA in a Geospatial World. And what is HIPAA? It's the Health Insurance Portability and Accountability Act. And it really pertains to data that's subject to these requirements, what we call protected health information, or PHI. I would say get the presentation, review the presentation, do it a couple times. It's by SD Garrity at ESRI. It has some great nuggets in there that help you to really be of service to other folks who are, having, various GIS, geospatial related questions when it comes to protected health information. The other thing that I would say to do would be to go out to the FEMA website. When I was at the King County GIS Center, we took at least 2 of the trainings. The one about the introduction to the incident command system, I think that's like a 100, and then there's like a 700 and 800. Those classes would be quite helpful if you're ever activated or called to support the COVID response effort in your community. Hello?
Hello? Okay.
Hello? Yes, so that's what I had.
Okay, well, great. Thanks, Cheryl. That sort of is a segue then into our next speaker, Dara Seidl. She is, as I am, an EthicalGEO fellow, and Dara and I and 2 other of the EthicalGEO fellows participated in a data privacy, HIPAA data privacy pod episode sponsored by the American Geographical Society last week. Dara's project for the EthicalGEO Fellowship Program is focused on personal privacy, personal geospatial data privacy. So, Dara, are you on the call?
Yes, I am. Hi, Greg.
Hi, Dara.
Thank you so much for having me, and it's been great to hear so far about the on-the-ground response to COVID-19 and the response from the different levels of government across the country. So thank you so much for all of the work that you're doing. My role in all of this is as an independent geoprivacy research and GIS consultant. And as Greg mentioned, my project for the American Geographical Society as an EthicalGEO fellow is to develop short films to teach high school and college students about geoprivacy concepts, primarily focused on the hidden consequences of sharing location data. So when I talk about geoprivacy, I'm referring to the right of individuals to determine when, how, and how much of their personal location data are shared with others. So in the current pandemic, the main challenge to geoprivacy that we're seeing are the proposals to track the locations of individuals. And so here is where I segue from the more GIS-rooted conversations we've been having to other proposals in the field to leverage cell phone location data to respond to the pandemic. So there are two sets of proposals around this, and these, as you might have read, have been in place in China, South Korea, and Israel, for example. So the first one is aggregating phone location data to see where people are not complying with shelter-in-place or quarantine restrictions. And the second one, which we in the ethical community see as more invasive, is using cell phone data for contact tracing, which is figuring out who is in the vicinity of an infected person in the last 14 days, and then who was in the vicinity of those people, and on down the chain. So many are calling into question the actual utility of this, with community spread so pervasive at this point. Will contact tracing add anything to the efforts to stop the spread? There are also many technical issues, which you in the GIS community are very much aware of. The first one being, how would location tracking handle accuracy issues with cell phones and smartphones? Given that cell tower location data is technically only good probably within a half mile, GPS data has error indoors, and then how would tracking handle people on different floors of a building? So yesterday in Israel, the Medical Association came out to call on the government to abandon the contact tracing cell phone program because it is diverting resources that could be used in the hospital response and doing very little to stop the spread. Another concern throughout all of this is what the government would do with location tracking infrastructure once the pandemic ends. So all in all, I am very enthused to hear about the wide variety of GIS project responses that do not invade privacy and allocate needed resources to the public. And I'm looking forward to hearing more about that.
Great, thanks, Dara. So our next invited speaker is Tamara Kamara from the City of Detroit Enterprise. She's the Enterprise Application Manager. Tamara, are you on the call?
I am. Can you hear me?
Loud and clear.
All right. I actually don't have a presentation. Detroit is, thank you so much for including us. I have about 3 additional team members who are on the call as well. And Detroit, as many of you know, is getting hit pretty hard. We are anticipated to be the next hotspot. In Detroit, we have a saying that we're the smallest town in a big city. Everybody, you throw a rock and you see somebody that you know are we're all about 1 or 2 degrees of separation from each other. So this is hitting the community very hard, of course. In terms of GIS, I manage 3 areas: the web team, the GIS, enterprise GIS team, and enterprise applications. And our web team, of course, is when we first started having cases about 2 weeks ago, just put up a web page. We called it a dashboard. It was just HTML. And they were manually going in. They didn't have any REST services set up because we were trying to figure out where to get that information from. They have now updated that where they're using Tableau actually, as opposed to anything geospatial. And so that's one of the reasons why I wanted to, so that our GIS team could offer up some geospatial references and just the notes I have taken from Fairfax County is amazing. We're going to go right to the drawing board and start mapping out a lot of these things. Especially, like we've got separate, you know, certain department mayor's office put out, you know, a map of the food resources for school children. It was great. And then you know, the health department put out something and has the hospital locations. That's great, but they're not all in one location. And so that's one of the things that we're going to work with the web team in order to, instead of having all of these things in desperate locations, having them all. And one of our team members, Tom, set up, I think it was on Friday last week, using the Esri hub, and did a first pass at, you know, putting in, and he included a lot of the things that Fairfax County has. One of the biggest challenges, and I've heard a couple of the other speakers say it as well, is data. And being able to, right now our health department, so just to give a backstory on our health department, there was this little event that happened in 2013 called the bankruptcy in the city of Detroit. And one of the things that was actually prior to the bankruptcy and the lead up to the bankruptcy, you know, the city had pretty much stopped cutting all the grass on the parks because they didn't have money for it. Had pretty much closed the health department, the public health department. It was outsourced to different nonprofits, and you know, so right after the bankruptcy, the new mayor, that was one of the things that we actually hired a public health director for our health department. And so we were in the process since 2013 or 2014 of rebuilding our health department. And so we're very grateful now that we have this, you know, built up health department now that's dealing with COVID-19, and they're doing an amazing job with very little resources. But we don't have that that connection, I guess, in order to, they're out setting up testing sites, they're out, you know, in the field doing the work. And so it's difficult for us from the GIS perspective to be able to offer them resources. You know, usually we have a relationship of they ask, we provide, and they're not asking because right now they don't know what to ask for because they're actually out doing the work. So I'm very thankful that we can actually offer up some of this to them. But in terms of getting the data, I guess that's one of the biggest questions I have for everybody when we're in the roundtable is, you know, where do you get those REST services from? Because your data is only as good as when you post it. You know, it's outdated immediately in terms of this, the COVID-19. So
I think that'll be part of the roundtable discussion coming up.
Absolutely. I look forward to it.
Thanks a lot, Tamara. I really appreciate your agreeing to participate in this on relatively short notice. Appreciate it. So the next speaker is George Horning. George, are you there?
Yes, I am, Greg. Can everyone hear me?
George is King County GIS manager, and he's the focus of a lot of the work and demands and resource allocation that we're trying to deploy and coordinate for King County GIS here in Seattle. Go ahead, George.
Hello, George.
Hey, Cheryl. Good to hear your voice.
Yes, it's good to hear yours.
For those who don't know, Cheryl used to work for the King County GIS Center for, what, 20 years?
Just about.
Yep. All right, so COVID activities within King County. So like many other jurisdictions, we've used the materials that Esri has provided regarding creating a data hub. So we use their template. We've been customizing it. We have not made it public because we have not been requested to do so, but we stand ready to do that when we are asked. That is it's kind of at the core of the challenges that we in King County in the GIS community are experiencing. I'm speaking of the county government, not the cities within King County, that the requests to us for support are few and far between. And when we do get requests, they are not necessarily something that we are publishing information externally. So, for example, we've done a lot of geocoding for public health and other agencies within King County that have requested our assistance. It'd be geocoding facilities that are of relevance to the COVID-19 pandemic, but again, not information that can be shared beyond who the client was that asked us to do that work. Like Fairfax County, we have created a school meals website. In King County, there are 14 or 15 school districts, each of which was publishing information about where kids could get their lunch meals, either by going to the bus stop. They were still actually routing some buses, and if the student was at the bus stop at the appointed time, they could be handed a lunch. Or some of the schools were also opening their cafeterias for grab-and-go meals. And the King County Public Health had published a web page that provided links to all of those school sites for that information. Well, we took it upon ourselves to go to those school sites and create a single feature class of all of that information. But once again, we have not been given the authority or the permission to publish that out publicly. We have borrowed from other jurisdictions within King County who were among the very first jurisdictions to be hit by the virus in the United States. The city of Kirkland has been in the news in that regard. And they created a responder tracking system using Survey 123, which was provided to their first responders, many of whom had to go into quarantine because they had been exposed to the virus. And then they needed to report their condition. And they could use the mobile functions of Survey 123 to provide their information back to the health professionals within Kirkland on their condition. They were required to do this twice a day. So in King County, we worked with the city of Kirkland to acquire the back-end tools, so to speak, for recreating that survey within our own environment. And we have that capability again to stand it up when we're requested. And then the final thing I'd mention in terms of COVID-related activities is the work we're currently engaged in with our public health EMS group. That's the Emergency Medical Services group, who are the owners, so to speak, of the incident response data that is countywide information. It's the information that a paramedic would fill out when they are on a call about the patient, where they picked them up, where they dropped them off, what their symptoms were, and so forth. And one of the jurisdictions within the county has actually created a dashboard of the data that they receive from EMS for their jurisdiction that is being provided to their squadron commanders, their fire chiefs, and that sort of group. And we within King County are now in the process of replicating that capability on a regional basis so that the entire county can have that kind of information. What we have yet to do is fully negotiate with the EMS folks who are the owners of that data as to what kinds of visualizations we can create. We feel that we could lock down the access to a dashboard that could show point-specific information that only the people that EMS authorized could have access to. We could also create dashboards using techniques such as tessellization that would disguise the ability to find any information that would be specific back to a given patient. But those are the kinds of challenges that we're dealing with in working through this, especially because of all the concerns that have been mentioned earlier by other speakers regarding HIPAA.
Okay, thanks,
Where
George.
are we? Well, I wasn't
I'm
quite
sorry.
done. Sorry. Unless we need to move on.
No, go ahead. If you had, some more remarks, go ahead.
Yeah, just a few more. Specifically in regards to challenges, if you are a GIS that is an Esri-based shop and all of your skills are reliant on using that suite of tools, and you haven't built up a skill set within other types of data science or data intelligence applications or platforms such as Tableau or Power BI, you may find yourself on the outside looking in. That has been somewhat our experience because King County Public Health is very much a Tableau-based data intelligence operation. And while we can provide them limited resources to provide base maps and that sort of thing that they can use in the background of their Tableau visualizations, we're very limited in what we can do beyond that. One thing that we take comfort in, though, is the aspect of the infrastructure that we've created over the last 20 years, plus within King County, of open data, the software that we've made available through our enterprise agreements with Esri, so that virtually anyone within King County government can use GIS. And so we're somewhat self-assured that there's a lot of self-help going on. In other words, those who are needing to use GIS are doing it and they're capable of doing it on their own without coming back to us within the GIS Center to provide those sorts of services. So with that, I'll conclude. Thanks, Greg.
Okay, thanks, George. Let me ask again, Joseph, are you on the call?
Joseph is on the call. Can you hear me?
Loud and clear now, Joseph.
Well, that's strange. I had unmuted my phone before. Didn't work, but I'm glad that I was able to get through this time.
Okay, so I've got your application queued up and I have your Word document ready to go and you want me to show that.
Super. Thank you, Greg. My name is Joseph Elfelt, and I'm a software developer in the field of online maps. My map that Greg has on his screen, and some of you can see, is displayed by GIS Surfer, which is a general-purpose web map that I built. Greg's screen is showing the mobile interface, which for data, his screen is showing a REST service that displays the Johns Hopkins deaths by county. The mobile interface consists of two large buttons in the lower right corner of Greg's screen. Greg's screen, I believe, is simulating what a cell phone would look like, tall and narrow. The two interface buttons are in the lower right corner of the screen, so they're easy for a right-handed person to tap on. And the map is zoomed in a bit on Washington and Oregon. And I would ask Greg to zoom in one step on your map, and because the Johns Hopkins data is by county, the county lines should appear on the map courtesy of the Census Bureau server, which sometimes doesn't work very well. And Greg, I would ask you to tap or click the base map button, and the screen will fill with a scrollable list of the different base maps and overlays that the map can display. And on a cell phone, the text is really large, so easy to see. And as Greg scrolls down past the base maps, then the list of overlays will appear. Some overlays are permanently built into GIS Surfer, and there are, I believe, 8 COVID-related overlays as well. I broke the Johns Hopkins County data down into two different ways. One layer displays the cases, another layer displays deaths. I also broke the Johns Hopkins state-level data down the same way. And there are other overlays that display the best hospital layer I found. There's an overlay that displays REST service that people can click on and see attribute data that will link to the COVID resources for each state. Scrolling through the overlay list, the way the interface works, an overlay that is on has a number in front. The numbers start at 1 and work their way up as overlays are turned on. The highest numbered overlay is on top of the map and is clickable to display all the attribute data the GIS server has for the thing that you clicked. And Greg, I'm going to ask you to turn the layer on that has the testing sites, and the number 4 should appear in front of that layer.
Testing locations?
Yes, please.
Okay, number 4.
And so if you would close the overlay list now, so we can go back just to looking at the map, the testing locations puts green symbology on the map. And one of the key things I wanted to demonstrate is how anybody can make a custom link that will open GIS Surfer and display the information that you want to see at the location you want to see it. So Greg, let's scroll the map to Portland and zoom in a little bit on the Portland area, please. And to zoom in, you'll have to use the plus sign in the upper left part of the map.
Right. Okay.
And now we're going to make a custom map link by having you click Menu and select Link to this map.
Link to this map. Got it.
Copy the link that you see, paste it into a new browser tab, and open the map.
New browser tab. Okay, cool.
We made a custom map, and that's just as hard as it was, which isn't very hard. So I'm trying to encourage anybody, whether you're in government, you're the public, anybody that wants to make a custom map link, go for it. So now I want to talk about the approach I used to use the map. And I do both passive and active posting in social media. For passive posting, I post on the GIS Surfer Facebook page, and I post on the Mapping Support Twitter feed. For active posting, I go looking for places to post. The social website Reddit has a subreddit for COVID for each state. On Facebook, each state has one or more Facebook pages for COVID in that state. So, for example, I would look for the Oregon COVID page on Facebook, and the first one I found with more than 1,000 members, I would join and I would post my map link there. And I would get an awful lot of really nice comments. It was very well received, which leads to a concern. And my concern is this, particularly through comments on Facebook, it was very apparent, 2 things. One, that the Facebook users were not getting the kind of information my map conveyed some other way. Because they'd say, hey, this is the first time I've seen this. I've been looking for this type of stuff. So they were not getting that kind of information through a website the state or county was putting out. And I also got a lot of nice comments that people liked how easy the map was to use on their phone. And I know from my server log, well over half of my users are looking at the map with their phone. So as people in the GIS world think about information that you can put out with the target audience being the general public, as distinguished from management or in-house, if your target is the general public, and you've heard this before, of course, your product has to look good and work well on a phone. So I won't dwell on that anymore. The big challenge I faced was finding rest service layers that were COVID-related and covered the USA. I was not looking for any finer grain than that. And so the only way I could find those layers was by looking at the various resource pages that Esri has. There's some other resource pages out there. Heck, I found out about the testing layer in my Twitter feed. And when I saw a map I thought might be driven by a REST service, I'd look at the map with my browser, and I'd look at the network traffic to see if the map was driven by ArcGIS, and then I could get the address for where the data was coming from and add that to my map. So I'm trying to help by solving the challenge of not being able to go to one place. Any GISer can now go to one place and see the list of layers I'm using on my map. I am publishing that list as part of the very large list of ArcGIS server addresses that I curate. And on that point, Greg, if you could throw up that Word file, please.
I've got it up here.
And so if anybody wants to follow up or find out more about what I talked about, one good way to do it is to go to my project page, mappingsupport.com, and there's some other links and information on the screen that Greg is showing you there as well, which is now recorded in the meeting. And that is a wrap for me.
Great. Thanks, Joseph. And thank everybody else. Let's start the speaker roundtable first. We've got about a half an hour left, so let's spend about 10 or 15 minutes. If any of the speakers have questions or comments for each other. Anybody want to start it off?
This is Joseph, and I would love to start it off as a King County resident and ask George, who makes requests to you for all the great information you have at your fingertips but is not being shared out to the world yet?
If I understand your question, it is who is asking us for support that we are keeping only internal? Basically,
you know, who needs to set you in motion and give you permission to share?
It would be the owners of that information. In this case, it would be King County Public Health. It could also be the executive branch within King County, as high up as Dow Constantine, our county executive, and his deputies.
Okay, thank you.
I actually jotted down some things when Tamara was talking, and you know, it really drove it home for me that as GIS shops are you know, thinking about how to use GIS effectively for COVID-19, you know, that we have to have two focuses. One is the focus of the citizen or the customer of the agency, so that's, you know, looking externally. And then the other one is the focus of the internal agency team. And a lot of that, when it comes to health data, you know, falls behind the HIPAA firewall for, you know, public health, or you know, we have, I think, some groups within community and human services that are within that HIPAA firewall. Anybody want to comment on, you know, how to keep that distinction in our minds and, you know, think about the potential? You know, what my colleague Patrick Jankanish talks about is we have a customer for a map or a web page, but then there's also the user. So the customer may be the same person, but it's a different map, it's a different web application for different groups of end users.
I might, this is Cheryl Wilder down here in Houston. One of the things that aggregation of data can help. Say you did a geocoding project, and this is totally not COVID related, but maybe you did a geocoding project for someone in public health, and it included some PHI in there, and we're saying that you have already, you know, have all your different let's see, they're not really certifications, but you have signed the non-disclosure. You already have watched the HIPAA video, and whatever data that you're geocoding for them, you have all the right certifications from your Department of Health and Human Services. If they needed you to do a test, you did it. You provided a product to them. But if you roll that data up to the zip code level, or, you know, some other higher level of geography, you gave it as a count by county, you gave it as a count by track, you gave it as a count by zip code, then the public health person might say, okay, I think I can share that data with the public.
Any other questions or comments amongst the roundtable panel?
Yeah, this is George. I just want to add to what I was following up with Joseph just now, in that I don't want my remarks to reflect negatively on the public health professionals within King County. They are doing a good job in terms of providing the information from their own websites and their own information forums. It's just that they we within the GIS community need to build up their assurance that if we act on their behalf in terms of providing information externally, that we are doing it in a manner in which they are comfortable with. So it's really the onus is on GIS to convince public health that we can treat their data appropriately, and that we will not do something that would be violate HIPAA rules or something like that.
Yeah, that's why I will send you, Greg, that navigating HIPAA in the geospatial world. I think I might have sent it when I agreed to talk a little bit. It really does help, and when you share that with the public health person, they'll say, "Oh, you really are thinking of us." And you can really create some understandings, trust. They would know that you understand what their concerns are.
Yeah, Cheryl, I found I did a Google search and I found the YouTube video and then also the link to the Esri page, so everybody should be able to find that quite easily. Yeah, thanks for that.
And SD Garrity is a great person because not only is she a GIS person, but she's also I think she's also a medical doctor.
Yeah.
She definitely leads their public health GIS program, and they are definitely willing to talk and help anybody that has questions about HIPAA and GIS.
Yeah, and I've heard her speak at ERISA GIS for Public Health conferences, and also at the Esri User Conference, which sort of leads me to, I've been involved in ERISA for many, many years, and they haven't had their GIS for Public Health conference for, I think, 4 or 5 years, and that may be an opportunity for them to, pivot back to something that is going to be on everybody's mind for, the next 3 to 5 years, I'm sure. Any other panel questions or discussion?
I do have one other comment along the similar lines that I was speaking about a few minutes ago, and that is that sometimes there is the impression that we are just duplicating what others are doing. We've been confronted that a couple of times where we've asked for information from a group within King County, and they have said, well, we've already done that. Isn't it just redundant for you to also do it? So that's another thing that we've confronted as well. And you're right, we shouldn't be just redoing what somebody else has done. We need to be doing a value add. And that's where GIS can help in terms of doing things more on a regional basis in the case of King County.
Yeah, that's a great comment, George. And I think it actually relates to the, thought I had from listening to Tamara speak in terms of everybody in an agency, not just GIS, has to be thinking of the information that we're sharing or providing from a customer standpoint. And, maybe this is a digital engagement sort of question, but do we best serve the, the customer in a situation like COVID-19 by having to go to many individual websites, or is there a central landing page where like with the KCGIS map compendium, we're showing a whole variety of different data related to different aspects of county business as a whole. Maybe there needs to be a similar approach for C-19 related response, not just on a GIS standpoint, but as a city or county wide approach also. Any other questions or comments amongst the panel, or if not, I'm going to open it up to everybody in the audience.
Greg, this is Steve. Could I make a quick comment? George said something that I thought was important. If your users are experienced with GIS and you've given them tools to use GIS and they have a rich set of layers, like the schools and city-owned facilities and community centers and all of this information, in a lot of ways they don't rush to you to help them because you've been helping them all this time, getting them prepared and how to use the tools and the data sets that they need. And if they aren't contacting you, that may be an indication that you've done a good job.
Absolutely.
Giving them the tools they need.
I see one comment here that was typed in from Joanne Markert. I seem to still be on mute. My comments are that one challenge is that we have more agencies responding to this than usual. And to Tamara's point, we often wait for requests to come in and provide, and that I think proactive approach with GIS makes sense. People working on emergencies are very busy and may not entirely understand how we can help them. We can be the cheerleaders. So with that, let me open it up to anybody who has a question or comment. We still have 150 people on the call, so if you can type your questions or comments in, that would be great. Dan Christensen has a question for Dara and Cheryl. I'll review the navigating HIPAA in a geospatial world, but I'm curious, are there provisions within HIPAA that allow for broader sharing of data to the public during emergencies, especially data that is aggregated at a local neighborhood level? If so, does our current pandemic qualify as an emergency? So Dara and Cheryl, any comments on that question?
I think Cheryl is probably more of the expert on HIPAA here, but my understanding is that no, that did you want to jump in, Cheryl?
Yeah, I would be in agreement. There's no special provisions or anything like that, but rolling up data to the zip code level, rolling up data to the census tract level, rolling up data to the PUMA. Those are public use areas, like micro data areas for the census. We had somebody who was very interested in that. PUMAs, sometimes those PUMAs kind of have the parts of town names that people like to hear that they might not identify maybe as easily with a census tract. Rolling the data up to those levels and still making sure that if you look in that navigating HIPAA in a geospatial world, that you're never pointing at any individual. Just like census blocks never does. They make provisions for that. Yes, as long as we roll the data up, yes, we can stay within the confines of navigating our geospatial world with HIPAA in mind.
So Chris Wright has shared a link to a document. I had actually been poking around the Health and Human Services Office of Civil Rights, but there's a bulletin from February 2020, HIPAA privacy and novel coronavirus. So this.
Oh, that's good.
Yeah, so this will be part of the record of the session. So I think just Google HIPAA privacy and novel coronavirus, and I think you will find this document. If you don't want to wait for it to be here. Brian Overman from EthicalGEO writes, GIS Pro in a city of 35 to 40,000 people, recognizing the HIPAA concerns, is there any sub-city level data available to us for internal use? I'd be happy to consume a county REST service that I can further filter to, say, census block or similar level.
Well, Brian, that's exactly what we're trying to work through with EMS. And as you may or may not know, the city of Redmond is able to receive a filtered set of data from EMS that provides incident level information. The question is that EMS needs to get the authorization from each jurisdiction, the medical contacts that they have at each of these jurisdictions, to then provide that data and to assure that it is only going to be seen by those who have the authority to see this sort of information.
George, if I may just follow up with my question, I spoke with Redmond directly about their dashboard and was looking for, where are you getting your information? And one huge downside maybe to this is that Redmond acknowledged that the EMS folks will respond to a call and deliver to, say, a hospital, and then basically that's where it ends. They never find out, there's never any follow-up with, was that person tested? Were they positive? Were they negative? So there's a big information gap even in that data. As good as it is, don't get me wrong, there's some information gaps in that data that could present a false view of things that I'd be concerned about trying to, close that gap. But I'm looking forward to you guys trying to figure out how to make that happen, because that was a pretty impressive resource.
So Brian?
Yeah, it is, sorry, just one thing. It is an impressive resource, and it is filtered on patients that are displaying flu-like symptoms. So you're absolutely right that beyond that, you don't know what the outcome was for that given patient. But it is at least telling you at some level that these are people who are expressing symptoms that may indicate that they have COVID.
So Brian, this is Melissa Brady from City of Redmond.
Hi, Melissa.
Hi there. I just wanted to let you know we are working, again, through King County EMS to try to get what we call outcomes. And so we are going down the path to try to find out how we can link that incident data to the actual outcome. And so that's sort of a next step for us. And hopefully we'll be able to bridge that gap. And as George mentioned, we're trying to figure out a way to get this as a resource for all of King County.
Yes, and I want to, stress that I wasn't trying to demean your dashboard in any way. I was super impressed when you showed it to me. I was just hoping that we could close that gap somehow, and it sounds like we're trying to make that happen. So awesome to hear. Thanks.
Great. Yes.
So real briefly, Chris Thomas made a comment that Dr. Garrity released a white paper last night on using GIS to respond to a pandemic on the ESRI COVID-19 resource page. I actually couldn't find it, but I'm sure that if I poked around more, it would be there. And then Bill Melman from Ohio said they've started using a Slack space with about 100 statewide GIS practitioners. He says we need a national network of like groups. How do we start this? And that I don't know. Other questions for the panel?
Greg, there's a question above that from Ben Levine.
Oh, that's a good question too. As we start to plan testing sites, understand them, hospitals, places of care, is street level imagery a factor? And, I presume Ben's question there is sort of doing reconnaissance of what would be effective sites. Ben, do you want to clarify that, or does anybody have any comments or questions on that idea? Ben, exactly. Okay. So any discussion about using street level imagery? I know the community transit, the transit agency in Snohomish County to the north of Seattle, was doing a GIS project to compile imagery of each individual bus stop, for training purposes, for analysis of the suitability of the bus stop, the signage, the shelter, what does that site look like in relationship to the rest of the community. So maybe some approach like that would accelerate identifying potential sites, to set up a mobile testing site, or a site to make, resources, food, stuff like that available to communities that were profoundly quarantined. And then Fred Lott is pointing out there's a coronavirus channel on the Spatial Community Slack. And here that is. So everyone can find that after. A community on Slack, 2,800 members and growing, the spatial community. Oh, and apparently there's a coronavirus channel within this. I'm not going to try to navigate to that. Other questions. Do any of you see a need for non-government GIS professionals to volunteer their time or skills to help with COVID response efforts? So far, we've seen only one request to GIS Corps. Any discussion about that? What's the potential for utilizing maybe students or retired GIS professionals in helping out, maybe in field work or data analysis? TJ Abbenhaus has a link to blog maps that mitigate epidemics on the Esri website, mapping epidemics from SARS, Zika, and Ebola to the pandemic of COVID-19, moderated by Dr. Garrity. And Chris Thomas says a group has initiated a COVID-19 GeoNet group that can be used to connect with other jurisdictions in a community setting. Link is on the COVID-19 resource page, or you can find it on geo.net. We have a few more minutes here. There's still 130 some people on the call. Other comments or questions for the panelists or amongst ourselves?
Joseph here. I guess I would be curious whether state PIO people are part of the loop here, trying to get the information out and doing some of the active social media posting that I described.
Joanne, do you have any insight into that at the state of Washington level? Oh, and she says absolutely. The State Emergency Center has a communications group, and hopefully they're connected with all of these, geospatial resources.
In very broad strokes, as I surf through the Facebook COVID pages for various states, and I would kind of skim down and see through the posts and that, I saw little to no posting by state officials at all. Not to beat up on anybody, but just to report what I saw.
Yeah. On the question of volunteers, Amy Loren from King County would say that there are needs for volunteers, but maybe not as much in King County because we've got lots of great resources here. She suggests maybe Snohomish and Pierce County. I think they have great shops also. I sort of wonder about, some of the smaller counties in Washington State, I was struck a few days ago that the test positive rate in some of the rural counties in Washington State was actually alarmingly high in the 12 to 15 to 18% range. That may be because of who's being tested, but this does seem like a potential need that someplace like GIS Corps or other volunteer service or organizations related to geospatial could provide. We're at the end of the advertised hour and a half. I'm going to stay on this call for as long as other people are on the call, but I want to thank our participants today, Stephen, Katie, Joanne, Daniel in absence, Joseph, Cheryl, Dara, Tamara, and George. I really appreciate your agreeing to participate in this on short notice. And if, as I say, I'll stay on the call. Let's open it up to general discussion, but if anybody needs to leave, that's completely understandable. Thanks, everyone.
Thank you.
And I will be sending out an email to everybody who registered and or who accepted the invitation for this meeting. So I'll send out an email when the recording is on the KCGIS user group webpage, so you can have access to all of these resources and share them with other people. Anybody else have anything for the good of the order?
I have a request, Greg. This is Peter Isaacson with the Health Department.
Hey.
And my HMAC is using my printer, my T1300 PS plotter, and unfortunately I am working from home and cannot help them. But my need is for a matte black ink cartridge. If anybody out there in the world happens to have one, I would sincerely appreciate that knowledge, and I can take that conversation offline.
And you're in the office, aren't you, Peter?
No, I'm not. I'm at home.
You're at home, but isn't a lot of public health staff in Chinook?
Yes, they are. That's why I'm staying away.
Got it.
But yeah,
you need to get that cartridge to Chinook.
That would be wonderful. I have 2 on order, but they're not arriving until next week. I'd happily, exchange one in the future for one today.
Yeah.
Kind of like Wimpy and the hamburgers, if you know what I mean.
I would gladly pay you for a cartridge today.
Exactly.
Peter, I would suggest using the Central Puget Sound GIS listserv to ask that question.
I'm hoping somebody in King County still has one of those ancient, archaic plotters, or at least just has an ink cartridge somewhere laying around.
Yeah.
That would be great. I appreciate it. Thank you.
Sure thing. Good luck.
Thank you.
Greg, this is Steve Beimborn.
Hi, Steve.
Hey, there were a couple other areas that have been really active for us. I just wanted to mention them in case people have been facing the same things and want to touch base. But we've done a lot of work trying to integrate Web EOC with ArcGIS Online, both pushing ArcGIS Online layers into Web EOC and publishing EOC boards, as they're called, out to ArcGIS Online. It's been interesting. It's not easy. I can't say we've been hugely successful, but that's one of the frustrations with the data being kept in different spots and just kind of wrangling the data and get everybody onto the same page. But that's an area we've been working on, and I wish I could say that it's been going really smoothly, but it's actually a little bit clunky to integrate those two.
Yeah.
I also want to mention a couple of the other areas that we've been working on. Is one of them, the Parks Department is trying to map where their staff is and how to relocate them. So we've been mapping the parks facilities, both public facing and internal, and the staffing. As staff are calling in sick and so forth, they've had to move people around, and so that's been kind of a useful endeavor that we've never been asked to do before, is sort of map staff from the human resources database to the facilities where they work. So that's been an interesting endeavor, and useful for parks to do their internal operations. Another area we've been working on is people want, in order to support small businesses, a lot of them are available for takeout or for curbside pickup. So you call ahead, they prepare a pizza for you, you drive up and park, and they bring it out to your window. And so our transportation department has been setting up pickup zones in front of businesses, and so that's been kind of useful, and they've been using GIS extensively to keep track of those things. So there's a bunch of areas we've been working on. A lot of it isn't that interesting to the public. I think the parking zones have been interesting. We've been able to map those along with our restaurants.
Yeah, that parking zone at restaurants for pickup services is an interesting one, and again, it's similar to the work that Community Transit was doing. So it was both GIS, but then there was integrating imagery. So again, from a training purpose for bus drivers, they had an idea of what a stop would look like as they were approaching it. And the company that did that work, I know, used drones to do all that reconnaissance, because there's like 1,000 bus stops. It's too much for. So I wonder what the potential is for drone technology with GIS for an application like this, to give people an idea of, where for this restaurant is that pickup area, where can, you expect to, have your food show up and stuff like that.
To the question someone had earlier in the comments board of, is street level imagery useful? Yes, it is. Hopefully your jurisdiction has that, and if not, I would say that using COVID as an example of where it can be useful. Fortunately for Seattle, we get it from King County every couple of years, so we're in pretty good shape in that department. So we appreciate King County helping with that consortium.
Yes. That's a very interesting point, is all these relationships. That's the one thing I think we're finding here, and probably everybody's finding all over the country, is that these relationships that you have with not only people in your governmental organization, or relationships that you have maybe with if you're a city, the county, if you're the county, the state. All these relationships, building them but through great means of data sharing through these, whether they're portals or whatever we want to call them, and also the just people-to-people connection really helps in events like COVID-19.
Definitely, you don't want to start during the crisis. You want to set those things up beforehand.
Exactly. A lot of the great data that we have is, due to some of those great connections.
Yeah, the other thing that I've been thinking as this whole situation has been going on, certainly for the last month, but even before then, was we need to be thinking about what we've done as individual GIS shops, to then talk about them and share these experiences at the next GIS conferences. Hopefully there's going to be a Washington GIS conference in Tacoma. Steve, any insights into that? But then definitely writing about this and the newsletters and things like that, so we can analyze what went well, what didn't go well, what we should do differently the next time something like this comes up.
Yeah, Greg, I have a feeling that if there is a Washington GIS conference in Tacoma in May, which I think that the governor will determine whether that happens or not, and I hope he does so soon.
Yeah.
COVID will be added to the agenda in a very big way. GIS in public health, perhaps, or GIS in emergency management will definitely be.
Oh, here we go.
One thing I found interesting was that it seems that the counties are most in touch with public health information. Maybe that's how it works nationally. But, the cities that we have not been, I mentioned earlier the need for the fire chief to know where COVID was present in senior care facilities. But other than that, we haven't been too involved at the city with public health type information. I think that's probably because we're a city and not a county.
Yeah. I wonder if, Joanne, are you still on the call? It occurred to me to ask Joanne and Daniel Stoelb if he had been on the call, the whole issue of ventilators, and if there is any national or at the state level, mapping or awareness. Maybe it's not mapping, but a database of where they are, which ones have been allocated and are in use, but which ones are in the the warehouse, or that keeps being described. And then also what the projected production is out of the ventilator manufacturing facilities that are starting to be stood up by Ford and General Motors and General Electric and companies like that.
Are you saying similar to plotter cartridges? Proximity is an important
similar
factor
to plotter cartridges.
Availability.
Yeah. And Peter Isaacson's specs are here for anybody who's still on the call within King County. Matte Black C9403A, 130 milliliter, for an HP T13 PS printer. It has a big 72 on the front of the box.
Greg, FYI, I will take them even if they're out of they might be out of date.
Yeah.
But I'll take it.
Okay.
If anybody wants to know how I make that work, you can talk to me offline.
Okay.
Greg, another comment that I think George made earlier with regard to Redmond and King County having the ability to communicate with each other sort of internally. I believe it was Cheryl earlier who was talking about those relationships, and that's another area where we need to make sure that we have secure ability to trade data with each other in a seamless way. And I feel that the work that we were starting to do with the Esri Hub at the county level with city participation kind of got tabled a few weeks ago, and I'd like to revive the idea of at least touching base and seeing if now's the time.
Yeah. Good suggestion. And Steve, this is, I think, going to lead to some interesting conversations with a regional GIS study that we're participating in. And, when I start doing the one-on-one meetings with individual agencies within the county, I think there's going to be a lot of focus on how, some relationships through regional GIS and a little bit of infrastructure could put us in a better position for responding to situations like this.
Definitely.
Yeah. Well, any other comments or questions that people want to share?
Can you hear me?
I can.
Oh, okay. Yeah, this is Gunnar, Greg. Just about, I tried to type in comments, but I was not able to. I'm just a guest. Years ago, I purchased a T1300 I believe it is plotter, and that also has cartridges with a 72 on it.
Yep.
When our old GIS team moved over to the Chinook building, we went up to the 9th floor and took the plotter with us. That stayed there. That plotter is up there on the 9th floor, the north end of the core section. And when I last saw it, there was plenty of resources, plenty of cartridges. I think it should work. So at least it's worth a look. It's on the 9th floor in the Chinook building, north end.
Peter, can you hear that? Are you still on the call?
Yes, I am still on the call, and thank you very much, Gunnar. I would totally love that. Yeah, we can. I'll have somebody run down there and take a look.
Yeah, I can't guarantee it. I believe it's actually at 1,300, but anyway, they do have 72 on the cartridges.
Yeah, that should work.
Peter, I don't know if you can see the note from Brian Overman that they have a couple. So give Brian a call or contact him at briano@issaquahwa.gov.
Yeah, I see it there. Thank you.
Okay. Well, we're about 15 minutes over. Any other last comments or questions before we close out the meeting? I think in any case at this point, I'm going to stop the recording. After I thank everyone again, both the panelists and the people who participated as attendees. Hope this was valuable. I'm glad we did this, and I appreciate everybody's involvement. With that, I'm going to stop the recording, but I'll stay on the call for a few more minutes.